Cap Gang 2019 presents Human Rights to Life, an informative whiteboard video presented by B. Waters, Emma Jolly, and Ryan Higgins. Life isn't really life. Life is birth and death. They're highly politicized and divisive in the context of reproductive rights and capital punishment. At first glance, these issues seem pretty straightforward. In terms of abortion, you can either be pro-choice or pro-life. The questions that define your stance seem like they should be very easy to answer. They're straightforward, they're black and white, they're pretty shallow. Should abortion be legal? When does life truly begin? Does the fetus feel pain? Most people base their opinions solely on these black and white, base-level questions. However, looking closer at the issue reveals a broad gray area, a subjective, complicated section of conditional answers to difficult what-if questions. Rather than allowing the issue to stay impersonal, these questions appeal to human morality in accordance with the nature of the issues themselves. What if the mother is unfit to raise a child? What if the fetus will be in immediate pain upon birth? What if the fetus has pre-diagnosed problems? What if the circumstances of the mother's life have changed since conception? What if the mother will be unable to safely give birth? The same is true for capital punishment. At first, the divide is obvious: pro-penalty or anti-penalty. Defined by questions of efficiency and satisfaction, the first glance opinion is made more complicated by going deeper into the societal implications of capital punishment and specific conditional questions. Is it fair or unfair to sentence someone to death? This is confusing. Is the eye for an eye mentality societally progressive? Is execution classified as murder? Is death better or worse than life in prison? If these issues were simply defined by facts, the politics surrounding them would be nowhere near as polarized. Because as human beings, our ethical views affect our factual interpretation, there is no easy answer.
When discussing abortion, you can either be pro-life or pro-choice. Pro-life and pro-choice is a question of who we should protect. The U.S. Census says that a person's age is calculated from birth date. On January 22, 1973, the U.S. Supreme Court declared abortion to be a fundamental right. The landmark abortion case Roe v. Wade remains as the law. The 7-2 decision stated that the Constitution gives a guarantee of certain zones of privacy. In the 1992 decision of Planned Parenthood v. Casey, it concluded that women can control their reproductive lives. Gonzalez v. Carhart of 2007 said restrictions on abortion infringe upon a woman's autonomy to determine her life's course. The majority opinion in Roe v. Wade states that the word person, as used in the 14th Amendment, does not include the unborn. White patients accounted for 39% of abortion procedures in 2014, blacks for 28%, Hispanics for 25%, and patients of other races and ethnicities for 9%. Last year, 42% of women having abortions were below the federal poverty line. "17% of abortion patients in 2014 identified as mainline Protestant, 13% as evangelical, and 24% as Catholic. 38% reported no religious affiliation, and the remaining 8% reported some other affiliation. The Planned Parenthood in Charlottesville provides contraceptives, in-clinic abortions, and therapy services. The Pregnancy Center of Central Virginia offers pregnancy testing, counseling, post-abortive care, and support. The Charlottesville Pro-Life Center is dedicated to peacefully bringing an end to abortion in Charlottesville through prayer and post-abortive healing groups.
The decision to send someone to death is one that holds a lot of weight, so it's fitting that there's a lot of discussion about our role in it. Every crime happens under different circumstances, leading to a lot of variance in how people think about capital punishment. Let's break it down. There are two sides to the argument: pro-penalty and anti-penalty. Those for the penalty believe that it is fair punishment that brings closure to the victim's friends and loved ones, and that it might reduce crimes in the future. Those against claim capital punishment is more expensive than life imprisonment and less effective, and that the methods are not humane. Death penalty statutes have a long history of revision. With Furman v. Georgia in 1972, the Supreme Court decided to suspend the death penalty, saying that it offended society's sense of justice. It was quickly reinstated in 1976 with the case of Gregg v. Georgia, when it was decided that it would be allowed only if the sentence was given at the time of the trial with an unbiased jury. Since then, the conditions in which the death penalty can be applied have changed greatly. It can no longer be given to someone deemed insane after 1986, someone 15 years or older after 1988, or those who are mentally ill after 2002. The most recent revision, made after the trial of Roper v. Simmons in 2005, found it to be unconstitutional to sentence someone to death under the age of 18. We spoke to Jennifer Givens, the Associate Professor of Law at University of Virginia, to clear up some questions about the death penalty. When we spoke to her about the methods that the death penalty was carried out with, she said that most states have a default of a lethal injection, but electrocution is also optional. Many recent studies claim that lethal injection can be extremely painful. We also asked her if she thought that it acted as a deterrent for crime, but she said that she did not think so, because most of these crimes were not thought out beforehand, will not be repeated, and that a life sentence can be just as effective. She also defended her stance on the issue by claiming that the judiciary system is often flawed and makes mistakes, that the juries can often be emotional when deciding the punishment, and that mental health is hard to defend in court. She also stated that we are still developing until age 25 and that punishing someone to death prematurely may not be moral at all.